The Swedes are also into centralisation of resources. Just across the play area from the family centre is the primary school. And next door to that is the high school, where I found Dr. Peter Andlin. He's a general practitioner paid by the state to visit the school twice a week and treat children brought to his attention by the school's full-time nurse. The morning I was there, a boy from the high school was having his back treated for a slight abnormality. The idea is that early detection saves the state the expense of an operation and the child unnecessary pain. I showed them some of the footage I shot from our New Zealand school. Scabies is occurring quite a lot in our schools. Do you see scabies as bad as this? This seems terrible.
No.
In the 70s, maybe, in a special circumstance, like you say.
The whole family's got this now.
It's obvious.
So now this is the school nurse, and she comes once every week, and the teachers have to say, you know, who's responsible. And they say that we have a lot of school swords. Do you see a lot of that?
Oh, for my eyes, it's maltreated. Too late. You see it very fresh and very early in stage. You see it and cover it.
So you would get this much earlier, wouldn't you? Because
yes. Normally the parents bring their children, but even it happens that the teacher discover things like this, but not that bad.
We get it before you go to hospital, so we prevent sick care. That is the healthcare big option.
Yes.
Though he found speaking English difficult, Dr. Anlin's message was clear. Swedish children don't get the preventable diseases our kids get because the government has made healthcare directly accessible to the children through the school system. If you want to know why Sweden's number 2 in child healthcare and we're number 29, second to bottom in the OECD, then you've just seen part of the answer. Child health is free in Sweden, and it's made accessible to every child at school. And it doesn't stop there. Every child in Sweden, rich or poor, gets a free lunch every day. Okay, so this tells the children what's in their food today. They've got gluten, milk, eggs, and some carrots. The stark contrast between what Swedish kids get as of right compared to what our kids get, in my view, tells you everything you need to know about why their children are so healthy and ours are not. In Sweden, the state makes sure that every child is fed a well-balanced diet. In New Zealand, the kids are eating whatever their parents give them, and often that includes cheap processed foods high in sugar that can make them obese. In Sweden, 24-hour medical care is free to all children in a system focused on prevention. In New Zealand, only some services are free in some places at some times, in a system geared to managing the crisis at the last possible moment. Like the Swedes, I think we need to develop an integrated vision for the future of our children. One which sees the daily basic nutrition for children as being part of the preventative health strategy for them, just like the free bottle of milk the government used to give me when I was a kid. We should do this. The question is, of course, can we afford it? So back in Wellington, I sought the opinion of Gareth Morgan, economist and author of the book The Health Check. Gareth, you've looked into the health system. Can we afford to give children free health care?
Oh, I think we have to do that, simply because preventative health is a far more powerful value for money option than having the ambulances at the bottom of the cliff. You know, hospital care is unbelievably expensive, and if you get kiddies in there with chronic illnesses, well, it costs you a lot of bucks to bring them back.
So it's smarter to spend the money in prevention than in cure.
It's about 4 to 1 in terms of the return you get on prevention as opposed to cure.
So for every $1 that we spend at prevention, we can save 4 in cure.
Yeah, that's the international data on that. Yeah, it's big return.
So the first way to pay for improved child health is to save 3/4 of what we're already spending. Secondly, we can stop shortchanging our children. This Ministry of Health document, released under the Official Information Act, reveals that children under 14 only get 10% of the health vote. But kids under 14 make up 20% of the population. So children are currently getting half of what they deserve.